Things are starting to get back to normal at UAB Hospital 15 months after the first case of COVID-19 was detected in Alabama, said Chief of Hospital Medicine Dr. Kierstin Kennedy. But the patients who have been admitted in recent months have been younger on average than they were last year. Pre-vaccine, primarily our patients were elderly, geriatric patients, Kennedy said. But now we've actually seen it shift a bit. Whereas before, the median age for our hospitalized patients was above 65, above 60. Now the median age for our hospitalized patients is around the 40 to 50 range. Vaccination rates are higher among seniors, who became eligible several months before younger adults. Kennedy said hospital staff still treats some older patients but has also hospitalized critically ill patients in their 30s and 40s. Older patients have higher risks of hospitalization and death, but Kennedy said the virus can be quite serious for younger people as well. We have admitted patients in their 30s, Kennedy said. The danger is oftentimes that you think if you get COVID you'd be just fine, but that's not a guarantee. In recent weeks, the number of patients treated at the hospital for active COVID-19 has fluctuated between about 12 and 20. In January, the hospital had more than 200 patients with the virus at the height of the winter surge. To put it in perspective, when we were at our peak, we had 8 physicians and 4 apps, nurse practitioners or physician assistants, taking care of just COVID patients, Kennedy said. And now that number has reduced to just 2 physicians. So far, there's no indication that patient numbers are spiking after the Memorial Day holiday, Kennedy said. We are experiencing these tiny peaks and valleys, so I would say on the whole, things have remained pretty stable, which is really reassuring, she said. As COVID cases have fallen, hospital staff are rushing to catch up on a backlog of procedures put off during the pandemic. UAB staff have also been heavily involved in vaccination campaigns in Jefferson County and surrounding areas. Many of the drive-through clinics operated by UAB have closed in recent weeks as demand for vaccines slowed. The groups that we're probably not seeing coming in for vaccination as much are the people who are historically healthy, those in their 20s and 30s, Kennedy said. Vaccination rates have lagged the national average in Alabama. Less than a third of the state's residents are fully vaccinated against COVID. Recently, UAB epidemiologist Suzanne Judd said the virus could persist in Alabama if people remain reluctant to get shots. President Joe Biden and the Alabama Department of Public Health have set a goal to have 70% of eligible adults vaccinated. All of these numbers mean we are moving out of pandemic COVID management and into endemic COVID management, Judd said.